Hair restoration, it's a very unique type of procedure. It's one where we have very effective solutions that are both non-surgical and surgical. And for a select group of patients, there comes a time where the surgical restoration, where we're actually doing a hair transplant, becomes really the best option for a patient.
So I had approached Dr. Asaria one day. I've been concerned about hair loss. I actually had a car accident where I traumatically lost a bit of my hair. Knew that he was doing these advanced procedures that look natural. And that's really what I was going for.
And that's part of the consultation process, is really determining when is the right time to undergo a hair restoration. Sometimes we'll start with things that are non-surgical. We'll do things like medications or PRP, which is an injectable treatment to help stabilize hair loss. And other times we're at a stage where we actually want to make a shift in the amount of hair and really change the amount of density and appearance of the hairline. So Angelo came to me like, again, many of my own friends or, people that I've grown up with and have known for many years, and I've kind of seen their hair thin over time. All of us are on that trajectory. Doesn't matter if you have a full head of hair like I do right now. I'm not always going to have this. Everybody in my family in their 40s and 50s loses their hair. But whether you're having a lot of hair at a certain point or not, we're all losing it at a certain point. We don't see many 75-year-olds, for example, with a full head of hair. Some of us thin a lot earlier on, so that's on the forefront in our minds earlier on when our hair's thinning as to the right time to restore it and what we should do. So Angelo came to me like a lot of people that I know and kind of said, hey, I know you do this procedure. Do you think it's the right time now? And truthfully, I work with Angelo in the operating room, so I see him with a scrub cap on most of the time. And I know Angelo, he's a good looking guy. All the other nurses and doctors like him. And I never really even actually considered or thought that it was a procedure that he needed or would want. But when I actually met him in consultation, I actually took a look at his hair and looked at him. I saw the way he styled his hair covered some of that loss of hair, and there was a lack of density in particular areas that forced him to wear his hair in a certain way. And again, for him, it wasn't like a night and day transition from having no hair to all of a sudden having a ton of hair. It was just progressively thinning and thinner in certain areas, where a transplant was perfect for him to add that density, add that richness, and still create a natural hairline that doesn't change him too much from where his starting point was.
So the procedure itself was pretty straightforward. I came in early one morning and basically prepped my head by injecting local anesthetic, which was not painful at all. It's a couple needle sticks for the donor site. And then once that took effect, everything was frozen. So I basically didn't feel a thing throughout the entire procedure. I was laying down in a very comfy bed and watching Netflix, and the day just went by, and I was very comfortable the entire time.
When we talk about healing process, we're talking about the donor area where the hair is harvested. That tends to look very normal in about 10 days to 14 days. And then the frontal area where the hair is transplanted. That also takes a couple of weeks for the little scabs to settle, as well as swelling in the forehead area to go down. When we see that hair growth, it really starts to grow right away. So it's just like if you've kind of freshly shaved, you feel the hair growing out, you feel the stubble. The hair does the same thing. And the hair grows very quickly, but then tends to shed. It tends to shed over the first 1 to 3 months. Oftentimes at the 3-month mark, it almost looks like we haven't done much for a lot of patients. And then we start to see the hair growing out, getting thicker, getting denser, feeling much more natural, really at 6 to 12 months out.
6 months, I see like significant changes. The balding areas are filling in like super nice. And with a short haircut, it's like there's no hair loss at all. So at 1 year post-procedure, basically I've got the hair that I had when I was 20 years old, so we're going back about 20 years.
I would say for considering hair transplantation, In general, it's one of the procedures that has the highest satisfaction rate of all the things we do. And that's because it's very predictable. The vast majority of patients get an amazing result, and kind of what you see is what you get. There's not a lot of mystery to it. We're really harvesting your own hair, and we're moving that hair to a location where there's a lack of hair. So patients tend to get very good results. I think sometimes the hesitation to proceed with a transplant, really there's this fear of it either looking unnatural or being painful or having a very long recovery, and none of those are really true. When it's done well, you really should not be able to tell. If you're considering hair transplantation, the biggest factor you need to consider is what is the potential for your outcome? And that's totally dependent on your hair loss stage. It depends how much you've lost and how much you have to donate. So some patients are amazing candidates, in other patients it's a more subtle result, or it may not be the right procedure. So it's really the consultation, someone giving an honest opinion saying, you know what, don't bother doing it. It's not gonna be good for you. You're already at this stage of hair loss. You're 35. When you're 55, we're never gonna be able to get you to where you wanna be. Or somebody we say, you know what, you have this contained hair loss pattern, you have a lot of lack of density in these areas, we can restore that completely. It will look tremendous for you. So really it's that advice that's important.